In Uganda, access to quality emergency care can mean the difference between life and death. To strengthen emergency medical services, the Korea Foundation for International Healthcare, KOFIH, in collaboration with the Ministry of Health, launched a transformative pilot project in the districts of Masaka and Bukomansimbi.
KOFIH, Korean Foundation for International Healthcare, is a public agency under the Ministry of Health and Welfare of the Republic of Korea. KOFIH supports government-level health assistance to the partner countries, including Uganda.
So the project focused mainly on 5 intervention areas, and these are leadership and governance, infrastructure development, emergency equipment, capacity building of health workers, and strengthening the referral system from community to regional levels.
One of the key pillars of this initiative was strengthening leadership and governance. Project committees were established.
We have been able to see the development of emergency care protocols.
Regional stakeholders came together to create a coordinated approach to emergency services. Leadership training was also extended internationally, with Ugandan officials receiving specialized training in South Korea. Improving infrastructure was central to the project.
Maternity department got a new maternity ward.
New regional skill and simulation labs, a call and dispatch center, and upgraded emergency units, including operating theaters, surgical wards, and neonatal units, were built to support effective care in Masaka and Butenga. Advanced emergency equipment, including 4 new ambulances, X-ray machines, and point-of-care ultrasound scanners, were introduced to ensure that health workers have the tools they need to provide life-saving interventions.
New operating light we are currently using during operations. Modern X-ray machine, which is in place, and on a daily basis we are able to do over 100 X-rays.
To build human capacity, health workforce training was done at the national level in the Ministry of Health, the regional level at Masaka Regional Referral Hospital, and the community level, empowering them to respond swiftly and effectively to emergencies.
The project has enabled us to train 1,700 health workers in courses ranging from advanced life support to basic life support, basic emergency care. We've also trained the regional ambulance drivers on how to deliver emergency care services.
508 VHTs were trained in CIFA, Community First Aid Responder course.
So this is a system that's responsible for providing care for people that have had sudden illnesses or injuries and need emergency care. All right, so this comprises of care that is provided on the scene. So when someone gets an injury or sudden illness, that can be in the community, on the roads, in the workplace, to care that happens when you're being transported from that point to the hospital. This is care that's provided by trained professionals who work on ambulances, ultimately to care that is provided in the hospital, okay, the acute care point or the emergency unit, as some hospitals have it termed.
To improve emergency referrals, a new call and dispatch center was established. It coordinates the emergency units with ambulance teams and community responders in real time, ensuring that patients receive timely, continuous care from the scene through transportation and the emergency department. At the hospital, trained staff triage, resuscitate and stabilize patients before they receive definitive care. This comprehensive system has led to a dramatic increase in emergency room attendance, with over 25,000 patients treated annually. Today, 98% of patients are triaged on time, and 100% are attended to within an hour. The KOFIH project has strengthened emergency care, reduced deaths, and saved countless lives.
Nifunake namba ya ambulance nenjikubira era tebalwawo ne badde ne bamutwala nitukira ku emergency ne bamukolako ne bamuzanzaba n'atereera. Mwebale nnyo, mwebalire ddala ab'ekitongole kya KOFIH.
Mine would be expression of gratitude.
They are so much grateful. They have never seen people who have good hearts like the Koreans.
I just want to appreciate KOFIH, especially the emergency medicine project, to identify the critical need and addressing it without conditions, without, but identifying with us our need and addressing it has been the cornerstone of the success.
This successful project, therefore, awaits being scaled up across the country.